Okay, so I was asked today for a video for Foley, so I'm going to do this real quick for you guys. So I have grabbed my supplies from the cart. The only thing I need is my Foley kit. If you want to use your own sterile gloves, you need to bring those in with you, but I'll be using the gloves from the kit. Got my doctor's order. I'm a hurt, Indwelling Foley Cath to gravity drainage, washing my hands, doing that. Hi, I'm Brandy. We met earlier today and I'm back. I have orders here to insert a catheter into your bladder. Have you been having issues with going to the restroom? Oh, you haven't gone since you got back from surgery. Are you having any pressure here? Yes? Okay. Well, I'll look that in a minute. Right now, let me see can you tell me your name and date of birth again? I'm a hurt. 1, 2, 3, 4. Great. That matches here. And do you have any allergies? No? Okay. What about to iodine, latex, or adhesive specifically? No, nothing to that. Great. Then I think we're ready. Elevate the bed to a working height. Got good visualization. Ms. Hurt, you had a bath recently? Okay, the CNA just left. I'm going to look real quick and make sure you're clean. If not, I'll be washing you up. Okay, you are nice and clean, so we don't need to do that. I'm going to thumb gloves and palpate the bladder. Ooh, there is pressure. You are feeling full. Yes, yes. So last time you actually went to the restroom, you urinated? Yesterday. Oh, okay. Well, it is 12 o'clock, so we definitely are going to have some relief once we get this catheter in. So I'm going to position you now. Maybe a little uncomfortable, but if you have any pain, please let me know. Peel up as best I can. There we go. Okay, so opening any sterile item, you open away from you first. Now, Foley insertion as sterile as possible. To me, the only actual sterile field is inside this box, okay? These drapes are technically non-sterile, they're clean. Okay, so I'm going to pull out my drape. Shiny side's down, so the shiny side should open towards me. And again, I don't consider this sterile. You want to keep it as sterile as possible, but it's going under the buttocks. Okay, that's good. Gloves. I've always used these gloves. Once you start to work on a unit, they're probably not going to want you using their sterile gloves for these procedures because they do cost money. So you should use what they have in the kit if you can. It's hurt if it would just remain as still as possible while I'm doing this because this is a sterile field and we don't want to mess it up. I usually put my fenestrated drape here. I do not use that. So inside the kit is what I consider sterile. So this tray, sterile, and I'm not touching the bottom drape with my gloves at all. I'm only touching what is in the kit. So open my iodine, pour it on my cotton balls, drop it there. Open my lubricant, put it over here in my tray. I didn't open that lubricant. Okay, I'm going to run without the lubricant, but in your checkoff, your instructor will be holding the little jar of lubricant for the mannequins. You're not going to use the lubricant in the kits. And then you want to be careful and maintain control of your catheter tubing when you're pulling it out of this. You don't want it flopping around, okay? I'm going to lay it back in my kit. So same as every other sterile technique, keep the arms up. And then we do not inflate the ball. Some of your old school nurses, myself included, will want to inflate the balloon ahead of time, but now it's recommended that you don't because you weaken the elastic. Okay, so I'm set up. I am ready to touch Miss Hurt. So Miss Hurt, I'm going to be touching you and I'm going to be cleaning with iodine, so it's going to be a little cold. Remember to remain as still as possible for me. So once I touch her, this hand is not sterile any longer and it doesn't move. So I need to hold the meatus open the entire time and don't let go, because if I let go, the flaps will fold in and it's not sterile anymore. So in cleaning the woman, so majora, and then I'm coming around. I'm not bringing my hand over my drop. I believe Miss Green will actually just drop her cotton balls right here. Drop. Menorah. Menorah. Meatus. Okay. And then this is where I would get my lubricant in my kit or from my instructor. And going in. And my sterile glove is not touching the vagina anywhere, okay? Just going as close to scoop my catheter in. Okay, I see urine. Advance 2 more inches. And then I'm going to hold onto the tube with this hand because I don't want it slipping out while I inflate my balloon. Inflating. 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 Okay, and then I'm going to tug. All right, we're in that bladder good. Let go. This syringe, if I let go of the plunger, it's going to squirt. So hold pressure on the plunger when you unscrew. Done with that. Okay? Now I'm going to clean her. That's why I laid that up there. All of the iodine off of you and off of my glove. Hang this. There's a hook on the bed. We're not doing it on the railing of the bed. It's on the actual frame of the bed. And then I'm going to tape this to my patient's leg. And I'll write date, time, and initial. Now if I needed to get a culture, I would do it right now, opening this bag. When you first insert a catheter, you can get it from the bag. If this patient has had the Foley in for an hour or a week and we need to get a culture, what you do is you clamp the tubing. That's what this is for. This little hook right here. You clamp the tubing like that. And then you're going to have a buildup of urine. You use a needle and you withdraw from this port right here. So you clean it with alcohol and withdraw using a needle and syringe. And that's how you get your culture from there. And make sure you unclamp it. I think they talked to you about spasms. If this patient is draining a significant amount of urine, you need to stay with the patient and clamp it every once in a while. I think after like 800 milliliters or 1,000 milliliters, it needs to be clamped. And let the bladder rest, because if we drain it too fast, you're going to have spasms, and that can be very painful. All right, Ms. Hurt, I have inserted your catheter. Now I'm going to take it out because you no longer need it. I have doctor's order. So to remove it, put the syringe on there and let it fill itself. Do it the rest away. The person that inserted it should have documented how much saline they infused in the ball. Some people only do 5 mils per the recommendation of the manufacturer of this, and you'll see on there it usually says a 5 mil bulb. I myself use the full 10 mils. Pull that out, and I'm going to wad it up in my glove because this has been up in, okay, so I don't know if you saw that. So it's here. What I'm doing when I pull it out is winding it around my fingers, because if I just pull it out, urine and gunk is just like flinging all around. So wad it up in your glove, and then you double glove just like you did for when you're here. Okay? And throw it away. All right, I think that's it.